All right. Good morning, everyone. Thank you for joining us for today's webinar session. So just before we get started, I'll run through a few logistical items, and then we'll hand the podium over to our presenters. So just the first note to make is we still have one webinar remaining in this series that's scheduled for next month. So if you haven't had a chance to sign up for it, or if you're interested in finding out a bit more, please visit us at childbride.ca/events for some details on the session and the link to register. So we have you all muted right now, and that's just to reduce some of the background noise and feedback that we might pick up during the session, but there will be a question and answer period with the facilitators later on in the session. So what we're going to try to do is just have you use the chat feature and indicate that you have a question. So just type the word question in the text box with the letter Q, and then we will systematically call on you, and then we'll unmute you, or you can unmute yourself. And then we will have you field your query to the presenters. So today's session, I'm sorry, I lost my notes. So today's session is titled Reciprocity, a Framework for Families and Researchers to Move on a Two-Way Street. And it will focus on parent and researcher reciprocity within an applied research setting and explore how this can lead to true and authentic partnership. We are truly excited to welcome our three facilitators. We have Darcy Fehlings, lead investigator of an integrated neuroscience network that's focused on children with cerebral palsy. Heather Shearer, a PhD candidate who is working along with Dr. Fehlings on a project that is exploring pain in patients with cerebral palsy. And lastly, we have Brenda Agnew, who is a client liaison at a personal injury law firm and a dedicated advocate for patients and families. Now, together, these presenters are part of a ChildBride team that's working on the Enhancing Brain Repair with Metformin project, which explores whether the drug coupled with physiotherapy can enhance motor and cognitive skills in children with cerebral palsy. So without further ado, it's my pleasure to hand over the virtual podium to Darcy and the rest of our presenters, and then we'll dive right into the session.
We're just dealing with some technical issues here, and I'm going to pass it over.
There it is. Okay. Share. Good share.
All right.
There we go.
Wonderful. There we go.
Minimize your all that other stuff.
Can you help me minimize that?
Sure. Let's just go like this. Now, you can exit that little box there too. The one in the middle, just hit the exit. There we go. You're off and running.
Good morning and good afternoon, everybody, and thank you for joining us today to talk about what I think is a really interesting and important concept in working together with different stakeholders as we move research forward. So Dr. Dan Goldowitz asked us to talk about reciprocity, and I thought, oh my goodness, reciprocity, can we really fill an hour talking about reciprocity? And indeed, we think we can. So we're really going to be focusing on a framework for families and researchers to work together. So what does reciprocity mean? It's really the formal definition is the practice of exchanging things with others for mutual benefit. And here we're going to be talking about reciprocity in an applied research setting. So it's this concept of exchanging things together for mutual benefit. So clearly, a key to successful reciprocity is garnering a clear understanding of what different stakeholders or partners are hoping to obtain from the exchange. And over the next little bit, we're going to be talking about what our perspectives might be. So when you have these aims and differing perspectives and they're clearly understood, it really gives you the groundwork to establish an authentic partnership. So this session will focus on parent and researcher reciprocity within an applied research setting. And we're really going to be talking about a framework to move forward in an authentic partnership. And we look forward to some active engagement as the webinar progresses. I'm just having some difficulty advancing my slides right now, so I'm just, maybe Heather, you could go
back to the PowerPoint. I can just grab it.
Yeah. That would be great. All right, so we got that one fixed. So Pierre has really kindly introduced the three of us today, and I am a clinician researcher, but I'm going to be wearing my research hat today. And then Brenda magnificently wears her parent hat. And I know many of you have probably met Brenda, but she is going to be presenting from a parent perspective. And then Heather is straddling both arms. She is a researcher and also a parent. So we felt between the three of us that we could provide these different perspectives. So here's our long-winded objectives. And the reason I wanted to put this up is just so that you can understand a little bit of the flow of how we'll be hosting this webinar. So Brenda is going to start and present on common aims, wishes, motivators from a parent stakeholder perspective. And then I'm going to share the researcher perspective. And we encourage Brenda to be very selfish in her perspective, and I'm also going to be very selfish in my perspective so that we really can present differing viewpoints. Then Heather is going to talk about a framework that really brings these concepts together and allows a sharing and development of an authentic partnership. And then we're going to open up the dialogue with you all to get your perceived barriers and facilitators and any comments that you might have. So before I turn the podium over to Brenda, I want to challenge everybody who is on the webinar. If you're a researcher, I want you to take a pen and piece of paper and write down your top 2 priorities in terms of what you hope to get out of working with stakeholders to move your research forward. And hopefully we also have some parents on the webinar, and I'd encourage you to do the same thing. So 2 things that you hope to get out of involvement in partnerships working with researchers. So without further ado, I'm going to turn the podium over to Brenda.
Great, thank you, Darcy. I'm going to speak a little bit about things, probably a lot about things, from a parent's perspective. Again, like Darcy said, be a little bit selfish in my perspective and offer the lens just strictly from a parent's perspective. So a couple of different things that I wanted to touch on. As far as, reason why a parent may want to get involved in a research capacity, and what the motivators and the aims for those parents might be, either perceived or actual. So sort of starting from the beginning, after my son was diagnosed with cerebral palsy, I think you go into an immediate flight or fight mode. And for me, I wanted to research as many things as possible that were happening out there. And so, getting into that, that research mode, it led me into realizing what was actually happening out there and then wanting to take that extra step to be as involved as possible. And so along the way, I've been able to reflect back on, what that role of parents in research looks like and why, why it's important for families, again, from my perspective. And so one of the things I start off from the very beginning is around hope. I think certainly from the perspective of when you get involved with a research initiative, there's always a hope there that it is going to impact your family, your child directly. So when you see research initiatives or research that is happening, you want to jump in on that, because is there a possibility that this initiative or this study may help your child directly? And then you sort of look at the broader picture, which is, if they're not able to help my child directly, is there a way that this research initiative may, or this study may help other children like my child or other families like my family? So while it's not a direct impact, let's say, on the functionality or an aspect of our life or his life, is this going to impact other families, and especially as they move down the journey? And I use an example of the metformin study, which I'm privileged enough to be a part of as a parent advisor, and that's a wonderful study that's going on, but the reality is that my son may age out of that, and that's okay. It'd be great if he was able to participate, but if he isn't, just knowing that our lens and our and my role in that may help other families is certainly significant. I think the other piece is right off the top is learning what research is. I needed to understand what was meant by research in the truest sense of the form. You learn it in science class, you hear the term, but what does that actually mean? And so trying to understand selfishly, what is the process? What are we talking about here? How do you get involved? What do the timelines look like? Why do things take so long? How do they determine what research people want to do? How is that research funded? All of those different aspects. And certainly I'm still learning after all of these years, the different nuances that come with putting together a research study, but it's helped me to understand the motivation of people, why they're involved in it, what they're trying to accomplish from it, and understand that when it takes a long time, it's not because somebody's not doing what they're supposed to be doing, but simply that's just the process. And that is extremely helpful as well when I want to build relationships with researchers and clinicians, is understanding the process that they're in and some of the constraints that they might be facing when they're trying to push an initiative or a study forward. So learning about that was extremely important from my perspective as a parent. Further to that is, as parents and as participants in research, we have an opportunity sometimes to help move the needle forward. And, by having us involved in a couple of different ways, so they could be things like helping to define what the research question is. That's a big piece that researchers not struggle with, but, what is that research question? And if a parent or a participant has a particular lens on that, it can help really define what that research question looks like. And then how do we move it forward? We can be helpful in ways that can, they are helpful for the researchers certainly, but selfishly they help the parents when we can do things like provide input on funding, help approvals go faster. We talk about the REB process, that can be extremely lengthy. And so if a parent is able to participate and help to expedite that process a little bit, that's only going to get us to the end game quicker. And so, again, selfishly, I like being involved there when I can help move that needle forward. We look at another piece, which is helping to create future initiatives. And so, what is coming down the pipe? What's up next? And, CPNet, that I'm also a part of, they have done an extremely great job of going to the parent stakeholder, going to the patient stakeholder and asking them, what is important to you? What do you want to see us focus research on? What would be a huge impact for your family and your child? And also looking at existing studies and what's the next step there. So if we're looking at a study that's involving children, let's say, of a GMFCS level 1 to 3, is there an opportunity for us to expand that study beyond to kids that are maybe with a GMFCS level 4 or 5? Can we open up the geographical scope? Can we open up some of the demographics, and can we expand that study? So being involved and having a voice in future research initiatives, I think, is extremely valuable as a parent that's participating. When we talk about having a voice as well, when parents participate in these research collaborations, we are able to bring forward a perspective that talks about things like, how to engage the community, how to better look at knowledge translation, how do we actually get people to participate in the study? And parents can identify some of those barriers. So maybe there could be a cost perspective. It could be the time that's being committed, things like that. And so we're able to sort of say, yeah, that sounds great and all, but are you really going to be able to get someone to come in 5 days a week, every single day with their child? And if so, what does that look like, and how can we make that easier for the participants so that they can be a part of this study? And then I think the other piece that I really want to get across before we pass it along, we talk about this collaborative relationship, is that being a part of this group and being a part of these initiatives, certainly there is change that can be made. There really is. I'm looking at this and I'm not sure if that's, but it says we're experiencing network difficulties. So and that's okay. I don't know if people can still hear me. I assume we can.
Yeah, you're still coming through.
Yeah, for sure. Okay, perfect. And so, we actually have the ability to impact change. And I've spoken before about, a project, or I guess project's the best word for it, but, for those of you in the CP world, you're probably very, very familiar with the GMFCS classification system, and it's the gross motor function classification system. And it is the gold standard globally as far as how we look at functionality, gross motor functionality for children that are living with cerebral palsy. And anyone that's doing any type of research into GMFCS or into cerebral palsy will have had experience with the GMFCS levels and the scale itself. And so for those of you that are familiar with it, there used to be a version of that, that the infographic wasn't the most friendly of infographics. And it sort of showed some kids that had some illustrations of children who were not in the best positions, and it didn't give the most favorable view of children who were, let's say, a GMFCS level 4 or 5. It had an illustration of a child with their head hanging down. It had an illustration of a child with their head strapped back. And so, through conversations with the researchers who were involved in the development of that infographic, feeding off of the input and the feedback that was coming from parents and clinicians, we were actually able to work with them to change that infographic. And now the item that is being used is actually a much more positive infographic that's being used globally. And it just gives off a better vibe. It's a more hopeful document to look at. And that was a direct outcome of a relationship between parent stakeholders and researchers and clinicians. And so there's definitely change that we can make together. So that's me.
Great.
Yeah.
Thank you so much, Brenda.
You're welcome.
So I am now going to talk about the clinician researcher stakeholder perspective. And I have an important bias to share with you all, that I am heavily supportive of the importance of working with stakeholders, and I feel from a positive perspective it really adds and is mission critical to moving a research project forward. And I think as clinician researchers, we've been on a real learning curve and trajectory in terms of how to effectively work and engage with stakeholders. So I'm going to talk a little bit about what I think are the most important issues from my perspective, and then we'll start to transition to looking at these differing perspectives within a framework. So when I reflected in preparing for the webinar on what I really felt was the most important things that I can get out of stakeholder partnership to improve the research that I'm involved in, the first thing I thought about is your research question important? And if you can't explain your research idea or question in a way that resonates with family stakeholders, I think you should go back to the drawing board. And it's a really important test that when you're trying to engage and develop your research idea, that it is of something that's meaningful to the family stakeholders. So is your research question important? That is mission critical. So the other aspect that I've put second here is getting information on important outcomes to include. So you as a researcher might come in with a particular slant or perspective on why the research is important. But ultimately, the most important outcomes are ones that are meaningful to the family. So getting information early on whether you have included important outcomes, I think is really important. One of the things that I've learned as a researcher over many years is I often include multiple outcomes. And I really look at the International Classification of Functioning framework that has many different aspects, but three core aspects of the ICF framework are potential outcomes that are in the body structure function area, and then in the activity area, and in the participation area. And one of the things I've really learned is that families really find the activities and the participation outcomes more important than the body structure function outcomes. So for example, if I'm doing research to look at what tone reduction or spasticity reduction does for children, it's much more important to look at how it can help them move their bodies or play or participate than it is to measure just the tone reduction. Whenever the third bullet talks to recruitment and of all the aspects of carrying out research, I find, aside from getting REB approval, I find recruitment issues are one of our biggest challenges. And we know families really want to participate in research, but getting recruitment and children into the studies that we're doing is always a little bit more challenging than I initially anticipate. And the families can really provide some important perspectives on issues that will impact recruitment. The fourth bullet talks about as you move your research forward. So these first three bullets are things that you should really be thinking about as you develop your protocol. But as you've carried out your research, another really helpful component of stakeholders from a researcher perspective is really getting them to look at the results and give their unique perspectives on the meaning of the results. I always learn a different angle, or I'm sometimes surprised that something is really important to a family that I maybe had neglected to think it was as important as it was. So I find the unique perspectives really helpful. The other thing that I am increasingly really pleased with is being able to present the results in a real-world context by really figuring out from the families why the research is important. So again, if you're trying to explain your results in a manner that is talking about the importance of it, families really put it in a real-world context that really makes it very helpful and often makes a clearer picture to the story that you're trying to tell about your research results. And then the final bullet that I put in is partnering with family stakeholders to disseminate the results. So I've been doing this more and more over the last few years, and I think that from my perspective, those presentations where I've presented with families are some of the more dynamic presentations that I've done. And I think that the people that are listening to the results are really able to take home information from the research that I wouldn't have been able to communicate as clearly. So those are my top 6 biased reasons from a research perspective why you should consider actively engaging in stakeholder partnerships with families. And then, as I mentioned, I think we're all on a little bit of a learning curve as clinician researchers. And when you can put something in a framework, I think it really helps you to stay organized. And you're going to see 2 infographics in our presentation today. And I know Pierre is going to circulate the slide deck. But this is infographic, a framework that the Ontario Brain Institute has put together. And I really love it. And I find it really helps to stay organized. So let me just orient you to the slide here. You'll see that I've got 6 yellow stars, and those are my 6 bullets that I've just talked about embedded into this framework. And then if you look at the columns, it's really a roadmap where you start and plan the study all the way horizontally across to disseminating the results. And then within the column, there are ideas of what you can do when working with stakeholders to really engage and build a partnership that helps to improve the research process. So you'll see that I've prioritized 3 stars in the planning of the study. So that identifying the research question, is the research important? Have you included important outcomes? And then recruitment clearly is important. I've moved to analyzing the results and put 2 stars there, that unique perspective, and placing the results in a real world context. And then a star in the disseminating the results. And so from a research team perspective, having a plan where you can work with your stakeholders right from the beginning, but there's different roles that they can play, so that role really evolves over time, I think is really helpful. So I encourage you to look at this framework. And then I'm now going to turn the podium over to Heather, and she's going to blend our parent and researcher stakeholder perspectives and also show you another hopefully helpful infographic.
This, this, and lost. There you go. Perfect. Thanks so much, Darcy. So as Pierre mentioned, I am a PhD student at the University of Toronto, and Darcy just happens to be my supervisor. But I'm also a mom of 10-year-old twin boys, both diagnosed with cerebral palsy. So I'm a bit of a hybrid in terms of my experience and knowledge that I'll be talking about today. So I do have experience participating in research studies on behalf of both of my children, and on studies on my own for kind of a parent perspective. But I also have experience working as a researcher, so as a clinical trial coordinator, as a research associate, and then of course working on my PhD studies. The interesting part is that I really don't have any first-hand experience partnering with family stakeholders. And when I talk about family stakeholders, I'm really referring to engaging individuals who have a certain disorder or illness, or their family members or caregivers, to get involved on a research team or a research project to help inform the full study. So I was fortunate enough this year, early in the spring, to be supported by the Kids Brain Health Network to take a course offered through McMaster University, on family engagement in research, and this was led by Dr. Andrea Cross. She was the coordinator of the course. And I've just got the URL up here if anyone's interested in taking a look at this course. I know they'll be running it in future sessions. And it's a really interesting concept because what it does is it engages both researchers and research trainees and then family members from right across Canada, and it pairs individuals to work together and come up with strategies on family engagement and research. And one of the projects was developing a tool to engage stakeholder in research for neurodevelopmental research specifically, because this was funded through Kids Brain Health Network. So I was fortunate to be paired with Christina McGuire, who's a parent out in Alberta of a child with complex medical needs. And we started talking about what we wanted to do and how we wanted to really help parents and family stakeholders get involved with the research process, because we felt there's a bit of a gap in this area to guide family members and family stakeholders in learning about getting involved in research. So some of the key things we felt was that it was important to develop a tool that would be helpful to the entire research team. So not only to the parent stakeholder, but also to the researchers who are conducting a study. The tool had to be easily accessible to researchers and patient partners. So whether it was distributed in hard copy, it was available on the web, it could be posted through social media accounts. It had to be really easily digestible and easy to read by everybody. It also had to be applicable over the life of the research project. So we didn't just want a tool that would bring someone in at the end of the project and provide input. And this was something that we heard from a lot of the parent stakeholders in the course, was that they didn't want to be seen as tokens on a research project. They really wanted their voice to be heard from the very outset of the study all the way through to actually inform the development of a study. So as Darcy and both Brenda had mentioned, starting with actual input on the research question and some of the outcomes that were being measured was really important to family stakeholders. And then of utmost importance was to develop an infographic or a tool that showed an equal partnership and really help sort of engage parents to feel comfortable going to the research team and asking questions and feeling like they were on equal footing with all the research team members. So at the end of this, we decided we were going to develop an infographic. Thank you. So I've just posted the infographic here. It's a bit small, but I'll do some subsequent slides where I break it down a bit for you. So what we did was we developed a checklist for patient partners in research. And when I refer to patient partners, this is individuals with a health condition, their guardians, parents, or any family members or friends who have intimate knowledge of care required for these individuals. And we really like the OBI framework that Darcy presented earlier and some of the other frameworks that are out there through the SPORE and Child Bright Network, but we really tried to condense this information to an easily readable format for family members and patient partners. So we simplified it quite a bit compared to the standard phases of research, because we all know there's a lot that goes into planning a research study. And we broke this down into having the parent or the participant ask questions to the research team. So every bullet we have here is a question that they can ask the PI or any member of the research team to get information on being engaged in the study. So this isn't being a participant in a research study, this is actually being a family stakeholder research team member, okay? So one of the key things was that individuals had to be treated in a very respectful way. They need to be provided information up front if asked for around ethics and background information to help them understand research a little bit better, and that the onus is actually on the research team to provide this information to parent stakeholders. So this started off with the what should I know So we thought it's important to know who all the team members are on the research team, but also what the background of the parent stakeholders are. So it's always useful to have, a picture of everybody who would be involved and then a little bio that can be circulated and discussed among everybody before the first meeting. One of the key things that came out in the course was parents often discussed frustration around lack of clarity with roles and expectations when being involved on research projects. So we really wanted to put this up front and have parents or patient stakeholders ask research team members what the roles and responsibilities are and what their expectations are for them being involved in the research project. So I'm not going to go through every question because there are quite a few here, but you can kind of see how we've structured it. And you'll see in the middle of the screen there's a little green circle with a dark green check mark. And the footnote for that is at the bottom of the slide, but essentially that's a check for every stage that's finished. The research team and the family stakeholders, so we now consider them part of the research team, they have to check in and make sure that everybody's on the same page, they all understand what's happening, the roles haven't changed, and if they have, how have they changed, just so that the relationships can continue on in a very productive way. So the second phase is really getting prepared to implement the research study, so finalizing the research question, the design and protocol, and completing any funding applications. So there are specific items there that the patient stakeholder can get involved with. So they can ask, like, how can I choose measurement tools so they're user-friendly, which is really important from a parent perspective. When they're participating in a study, you can imagine how frustrating it can be to fill out packs and packs of questionnaires, which are fairly difficult to understand. So make sure that they have appropriate outcome measures that really get to the root of what's being asked, but are also, child-friendly if you're dealing with children, or the language is appropriate, and so forth. So the second half of the infographic is phase 3 is the execution. So this is really getting ready for the study to start, dealing with recruitment and collecting and analyzing the data. So what can the patient parent provide in advice to improve study recruitment? And Darcy mentioned this is a really difficult part in conducting studies, but parents and family members have lots of experience in terms of trying to navigate around their schedule and what would work for them. So a good example is with the research that I'm doing is I make sure that I offer evening and weekend appointments so that the children that I'm studying don't have to be pulled out of school to participate in the research study because they're already missing enough school going to specialist appointments. And it's a big concern we've heard from parents, so we try to accommodate for that. And I can tell you the parents that we've spoken to really do appreciate that. So what's the best way to collect data? Can I give advice to help overcome barriers? So these are the kind of questions that parents can ask and then provide information to their research team. And then ultimately, how can we share our results? So this comes down to the knowledge translation. So will they be expected to present their results at a conference, or can they share the results on their social media accounts? And how do they go about that? Or can they help provide lay summaries of information, which is really important in terms of getting the study information out to the consumers. And that's what we're talking about here. So a goal is always to publish our study results in journals and present at conferences, but ultimately we want our information to reach those people who it's affecting the most. And then the link at the bottom of the infographic is actually the link where this infographic and all the infographics and posts and blogs and videos that were produced by all the students are located. So I really encourage everybody to go and take a look. There's a lot of great information and really good resources there, and they're in the public domain now, so it's good to check them out. And a lot of excellent minds worked on these and produced some really great work. So great, that's everything.
All right, so we've now come to the interactive component of the webinar, and I'm going to turn it over to Pierre to help to facilitate this, but we know there's lots of you around the country that are on the webinar, and I gave you a challenge at the beginning to think of your top 2 priorities. So perhaps if you're sitting there and you haven't had your priority discussed by Brenda or Heather or myself, you could share the priority that you have brought forward. So we're going to start there.
Right, wonderful. Yes, thank you, Darcy. So if anyone has any comments, feel free to unmute yourself, or if not, just indicate in the chat box that you are open to share a thought, and we can unmute you on our end.
Oh, now please don't be shy.
Hi, Darcy. This is Dan Goldowitz. Great presentation. I'll try to kick these off to break the ice. In the
Thank you.
Okay. Well, it was really fun listening. In the diagram you showed from Ontario Brain Institute, it sort of stopped at dissemination, and I'm thinking that changes in policy and things like that are even more critical than, it comes from dissemination. So why does it stop there, and what ideas would you have for creating extra columns, I guess?
That's great. I've just flipped the infographic up, and Dan, you've really highlighted a really important point that at the very right-hand side, you can see that there's this little 2 black arrows that talk about continuing the relationship. So this particular infographic really focuses on the clinical research project, but actually moving things into policy and mobilizing your research findings to actually make change in practice is something that's really, really important. And all of these steps really help to make your research impactful, but there's a lot of effort that needs to go on. So those black arrows really start to reflect some of the concepts of a continued relationship so that you can move things forward to actually change care. So thank you for that comment, Dan. Do you have other suggestions in terms of sort of moving things to policy or changing practice? Because this is something that we always hope to do, but in the past, people have done some research, and I think the average length of taking a research finding into clinical practice was sitting at about 22 years, which is pretty long.
Yeah, that's beyond my expected lifespan. Yeah, so what Child Bride is doing something that I think is nice is that the knowledge translation program, I think Connie's online, is developing a policy forum, and that's with Keiko, Chicago Thomas leading that. Policy Hub, and then which should hopefully sort of push specific issues towards changes in policy. And the second thing is our training committee that you all so generously contributed to is doing a policy forum at the annual meeting. And that's another way to sort of, and it's something that we really learned is that throughout your whole presentations with Heather and Brenda and you, it's the researchers coming together with the parents and the patients, and we know that in some ways it's the most important thing for getting change of policy for parents and patients to be there. And of course the researcher is, because that's some of the content, but so that's another sort of moving forward into that next column, I guess.
And I think, tying it into the focus of today's webinar, which is around reciprocity, I think one of the most helpful things to make your research impactful and to be able to eventually bring it forward to policy or to influence clinical care is these concepts of, is your research important, and really looking at your research idea and that partnership and the feedback you get from families right at the very beginning as the idea is germinating. I think is really mission critical to speeding up that road to impact. So I find this stakeholder relationship really important, and I think it will help to speed things up. So did anybody have any priorities that they had generated that we didn't talk about, or maybe we hit the important ones? Okay, so perhaps then what we can do is get some feedback on perceived barriers or experienced barriers that you have as researchers or parents in terms of forming these stakeholder relationships. So again, please feel free, don't be shy, jump in. We'll give you a minute, but maybe Brenda and I can dialogue a little bit about sort of one issue that, Brenda, you had talked about in your discussion around the length of time it takes to bring a research project forward, and that often there's differing perspectives, and we can maybe talk a little bit about the metformin study, which is part of Child Bright, and as researchers, we feel like we've been working full time to try to move it forward, and 2 years later, we now finally have REB approval and Health Canada approval. But just from a parent perspective, trying to sort of wrestle with the length of time and all the processes that we need to jump through to move research forward.
Well, and I think that's a really good example, because if people are at all familiar with metformin, and I wasn't, so let me preface that. It's not like I have this wealth of knowledge on every drug that's out there. But when I started to really look into metformin, I mean, it is a drug that is commonly used in other applications. So it is used in the diabetes world. It is used for polycystic ovarian syndrome. So it is not this new drug. And so, you know, sort of myself and some of the parents I spoke to is, you know, you look at something that is already being utilized out there. It has been proven to be safe in a number of different applications. And so when you think, okay, amazing, we're just going to move that along right into this application. And also prefacing this also by saying that this study, also, a similar study had taken place in children who had had a brain cancer and who had a tumor removed and were left with some damage to the brain. And so they had been part of a metformin study where we did see some positive results as far as some gains there. And so, you know, from a parent's perspective, we're like, okay, this is easy peasy. Here we go. Let's just move it to the CP world. We've already done this in one population of children who have had a brain injury, although different causation, and we know it's being used in other capacities. And, you know, I remember sitting down with Dr. Frieda Miller years and years ago and sort of saying, all right, what do we got to do? Let's get this going. And wow, you know, I was shocked at the number of comments that came back that were, you know, were helpful, but I had no idea about, again, like Darcy said, processes. And, you know, when you're looking at things with children, you know, there's so many different factors to consider, puberty and all these different things that were going on, and it gave me a pause to think. But yeah, from a family's perspective, even from an REB perspective, when I look at the REB process and I think, oh my goodness gracious, and you know, you look at some of the things that come back in REB that as a parent I'm looking at their concerns, and I'm saying as a parent we're not concerned about that. And so that's where we talk about the value of having parents involved at the very beginning, is maybe to help move these things along. But yeah, so from a parent's perspective, we're like, tickety-boo, what's going on here? Why is this taking so long? And then like Darcy said, she's like, we're working really hard. And there really is a disconnect, and you know, on process and why it takes so long. And there's always a perception that, I think just in general, right, in some of these fields that, there maybe isn't as much of a sense of urgency, right? We're the ones at the end of the day, it's the parents who want to get their kids into it, or it's the patient who wants to have the benefit of the impact of that study. And there's a perception that the researchers are just like, not the urgency isn't there, which I know not to be true now. Yeah.
Brenda has to say that because she's sitting making eye contact with me right here. So, this is an area where communication and working together is really helpful, because we as researchers need to understand the family perspective about really wanting to move something forward. And then from the family perspective, it's really helpful for them to understand all of the different aspects that we need to go through to ensure that we're moving forward a safe research project that's following process. So I don't know if anybody else would like to share a barrier that they've experienced.
So Darcy, we did get a comment through the chat function, and so we had Vivian who asked whether any of our facilitators today have advice about engaging families or populations that are typically hard to reach and whose voice usually is so critical to have at the table as well. So if you have any thoughts on how to involve challenging populations to reach out to.
Yeah, sure. I think we could probably all wade in there. Brenda, did you want to start, and then I can add, and Heather?
Yeah, I mean, I can say a really quick piece. You know, I know that that's a concern that we have. I sit on the Citizen Engagement Committee with Child Right. I know that that's always a challenge that we have, is how do we, you know, it's far more likely that you're going to be able to get participants from, you know, some of the bigger centers, but how are we truly reflective of the overall population, and how do we reach out to them? So we do struggle a little bit in trying to make that happen. We sit down and spend a lot of time identifying some of those areas where we feel like we're not getting as much involvement, and so, you know, a targeted approach on how we do that. We'll often put our heads together and strategize on that. But, you know, one of the ways that we've also found to be extremely effective is, we go back to this parent piece, is engaging parents to find other parents. And, you know, when you look at, you know, I moderate a group, a Facebook group for 1,900 families. And so when you have the capability to do a far and wide call to action, that's helpful. So, you know, that's been somewhat beneficial in being able to reach people that you may not be able to initially reach with a flyer or some other method of advertising the study that's going on. But it is a challenge. There's no two ways about that.
Thank you, Brenda. Brenda helps to facilitate a group called Parent Advocacy Link, and it's absolutely fabulous. And we've built that link, and it's one of our opportunities to look at potential recruitment. Again, a nice example of a relationship facilitating an aspect of research. But to go to the question in terms of how do we facilitate diverse representation of stakeholders, the two comments that I'll make is, I think it's really important to identify what you feel are important components to have representation on, and then specifically try to target to ensure that you reach out and bring that in. So it might be you want to ensure that you have a father perspective, or you want to make sure you have somebody who lives in a rural community perspective, or you want to actually have a perspective of an individual. In my case, my research is usually focused on children with cerebral palsy, and so we will reach out to youth or young adults with cerebral palsy to be on our stakeholder committees. And so identifying what aspects you want to ensure have representation is really helpful. And then the other comment I will make is that use of technology, I think, is really helpful. So when we're running our stakeholder groups, we're using technology where if we have a slide deck, we can use Zoom or GoToMeeting. We do teleconferences, so everybody doesn't have to actually come on site. And so technology has been our friend in terms of helping to facilitate engagement. And Heather, did you have any?
Yeah, I completely agree. And I think it depends on what barrier it is you're looking at. So whether is it a barrier of physical function, one of the comments that came up is a barrier of ethnic and socioeconomic representation, which is absolutely an issue. Is it a cultural barrier? So all of these issues need to be identified. and they need to be identified early on. One thing that I found with running my pilot study was I had parents who their children weren't eligible for the study, but they provided input in terms of what I could potentially change or how I could modify things for the next phase of my research so that their children could participate. So, for example, I would go to someone's house because their child couldn't get here just because they had low physical function. So that's something that we've modified in our research protocol because that's important for me to include a wide level of function in my research participants. But there are several different barriers that I think if you can get the perspective of the patient and the family and help them, have them help you develop strategies to address these, it really is a great resource to focus on these. So I agree.
So I know we're coming to wrap up now. So we just have 2 slides talking about potential benefits, and we've I think really highlighted some of the potential benefits as we've gone through our discussion today. And then the potential pitfalls. We've talked about the long timelines to move research forward. Research is incremental and it builds, and so sometimes your end product or result is something that's an incremental build and not something that you can directly translate into policy. Miscommunication, including long lags between communication, is something that I think you really need to manage. Lack of clarity around roles, expectations. We really want to move away from tokenism and really build this authentic partnership. And then the last bullet is something that we just talked about in the question, that sort of difficulty in including a variety of stakeholder perspectives. And we really thank you all for staying with us today on this webinar. And if you want to email us, we have our email included here. And thank you for joining us today. So back to you, Pierre.
I will unmute myself. I just want to take a chance again to thank you, Darcy, Brenda, and Heather, for taking the time today and walking us through that framework that you were covering. Your insights are definitely greatly appreciated. For those of us that are still on the line, I just want to briefly make note that following the webinar in the next day or two, we will send you a link to a recording of this webinar along with the slide decks that the presenters are graciously sharing with us. I just want to make note that in that note as well, we'll have a bit of a feedback survey in there. That takes about a minute to complete, and really it's just a great way for us to find out a bit more of the various topics that you would want to see us cover in a series like this, so that we can start developing those and identifying another great set of speakers. And now, should you have any additional input, our contact information is here on the slide. Feel free to visit us at our website or contact me through email, and we'll be happy to engage you in that way. So again, thanks for joining us, and we hope you enjoy the rest of your week. Take care. Bye.
Good job, ladies.